Hello, class. Hi, everyone. My dissemination and implementation practice project focuses on implementing a structured mentorship program for newly graduated CRNAs during their transition into independent practice. I chose this topic because although nurse anesthesia programs provide us with extensive clinical preparation, graduating and transitioning into independent practice can still be a significant adjustment. As new CRNAs, we go from practice within the structure and supervision of a nurse anesthesia program to independently managing complex patients and assuming full responsibility for anesthesia care, which is a lot of responsibility. Research shows that during this transition, new providers can experience increased stress, decreased confidence, and difficulty adjusting to this new level of autonomy. Without adequate support, these challenges may contribute to burnout, decreased job satisfaction, and ultimately workforce turnover. Most healthcare organizations provide some type of formal orientation for new CRNAs. However, the problem is what happens after the orientation ends. Many organizations rely on informal mentorship, so the amount and quality of support a new CRNA receives can vary depending on staffing, scheduling, organizational culture, or simply whether an experienced CRNA is available and willing to provide guidance. Therefore, my project addresses this gap by proposing a structured 12-month mentorship program for newly graduated CRNAs during their first year of independent practice. Experienced CRNAs would be recruited as mentors based on their clinical expertise, communication skills, and interest in professional development. They would receive standardized mentor training and then be paired with newly graduated CRNAs based on factors such as clinical interest, professional goals, and scheduling compatibility. Each mentor and mentee would meet monthly throughout the first year. These meetings would focus on areas such as clinical decision making, professional development, leadership, stress management, and reflective practice. The goal is to provide new CRNAs with a consistent and supportive environment where they can discuss challenging situations, ask questions, and continue developing their confidence as independent anesthesia providers. The framework guiding my project is CFIR, or the Consolidated Framework for Implementation Research. I chose CFIR because it helps evaluate not only whether an intervention is supported by evidence, but also the factors that may determine whether it can actually be implemented and sustained within an organization. For example, CFIR allows us to consider the mentorship program itself. External factors such as workforce shortages and increasing surgical demands, and internal factors such as organizational culture, leadership support, communication, and readiness for change. It also considers the individuals involved, including mentor preparation and mentee engagement. Implementation would occur over a 12-month period with data collected at baseline, 6 months, and 12 months. I would evaluate both implementation outcomes and effectiveness outcomes. For implementation, I would look at areas such as participation, adoption, feasibility, acceptability, and whether the mentorship program is being carried out as intended. For effectiveness, I would evaluate clinical confidence, job satisfaction, perceived organizational support, and first year CRNA retention. Some of my specific goals are to increase clinical confidence by at least 20%, improve first year CRNA retention to 90%, increase job satisfaction by 15%, achieve at least 90% participation in monthly mentor mentee meetings, and maintain greater than 95% adherence to the mentorship protocol. There are also potential barriers to implementation, including staffing shortages, scheduling conflicts, and limited mentor availability. These challenges would be addressed through leadership support, protected mentorship time when possible, regular communication, and ongoing quality improvement using plan, do, study, acts cycles. Ultimately, the goal of this project is to make mentorship a consistent part of the transition into CRNA practice rather than something that new grads have to find on their own. A structured mentorship program has the potential to improve clinical confidence, job satisfaction, professional support, and retention among newly graduated CRNAs. From an organizational standpoint, improved retention may also reduce recruitment and orientation costs while creating a stronger and more stable anesthesia workforce. Overall, this project is about creating a more intentional bridge between graduating from a nurse anesthesia program and becoming a confident, competent, supported, independent CRNA. Thank you for your time.